is Norm Volsky, your host, and this is the Digital Health Heavyweights podcast.
Thanks, Norm. It's an honor to be here, and it's been fun to work with you over the years.
Hello, and welcome to the Digital Health Heavyweights podcast with your host, Norm Volsky. And today we are thrilled to have Bud Flagstad on the pod. Bud, welcome to the Digital Health Heavyweights.
Thanks for inviting me.
Absolutely. So for all of our listeners and viewers that are unfamiliar with Bud, Bud is the Chief Executive Officer at Empower Health, formerly known as Care Angel. He is leading a team of professionals that drive efforts to extend outreach, increase access, convenience, and quality, simultaneously reducing healthcare costs, enhancing system efficiencies and efficacy, and empower consumers to maintain and improve their health and wellness. Their collective goal is to deliver the best AI-enabled health engagement solution on the market. Bud also is an advisor to Vitality Health, executive chairman at MyroDX, a board member of Remo Health, a respected leader in the healthcare technology space for the last 30 plus years. Bud had previously held positions as the SVP over at UHG within research and development. During his time at UHG, he spearheaded numerous innovative products, services, partnerships, and acquisitions. In 2008, Bud built a team and developed UnitedHealth Group's first telehealth offering in partnership with Cisco. Bud was also the CIO at Definity Health when it was acquired by UnitedHealth Group in 2004. So welcome to the pod. You have a lot of great experience that we can't wait to jump into.
Thanks. I really appreciate it.
Absolutely. So Bud, ask everyone who comes on the pod, what inspired you to get into healthcare?
Yeah, it's a great question. My mom was a registered nurse for 45 years at a local health system.
My mom was a nurse as well.
Yeah, I can't believe my mom stayed at the same health system for 45 years. So 1964 to 2009. And she was also the chief diabetic educator there. So she did a lot of work in that space. And when I was in college, she did a lot of stuff with Eli Lilly, and she said, hey, they asked if you could write some software, and this is back in, the late 80s. Can you write some software to help us track this new number called hemoglobin A1C? And I'm like, yeah, sure, let's create a database for you. And I built an application for them to track it across all their diabetic educators as they were developing new therapies for healthcare. And that was probably my first entrance into healthcare. And then I went away from it, but they paid me, and I was in college, and I was writing software, and I was going to school for computer science and business management. So it was a perfect example. And, I started in technology when I was 8. My father was in computers back in the 60s with IBM and ran numerous computer companies locally. So I've always had access to tech.
Fantastic. Walk us through your experience at UnitedHealth, and we'll try to keep it to 20 minutes.
Yeah, no, for sure. So I joined UnitedHealth Group almost by accident. I was working at a company called Wolters Kluwer Financial, based in the Netherlands, but here in Minnesota. And we had to pick our benefits one year, and I picked this company called Definity Health. And I thought, oh, that's cool how they do health plans around consumer-directed health. And I was like, this is pretty cool. If I stay healthy, good things happen. And if I get sick, they still take care of me, but I get some credits for staying healthy. So I signed up for that, and I was working for Wolters Kluwer, and a recruiter called me literally halfway through the year and said, hey, there's a company called Definity Health looking for a CIO. You interested in talking to them? I said, yeah, I am. Where are they located? He said, Minneapolis. I go, wow, I thought everything was in New York for them. But he said, no, they're based in Minneapolis. And I got pulled into that to an interview. I met with the CEO and the other co-founder, Kyle Rolfing, who's also in the healthcare state as well. My first question is, you're going to go public, right? Because I wanted to take another company public. I'd done that in the medical device industry. It's a blast. And I really wanted to go through that again. And they said, yeah, we're going to do it. And I said, you're not going to get acquired, right? No, there's no interest in acquiring us. We want to move forward. We're not an acquisition target. Well, 2 weeks after I joined, Steve Hemsley, who was then the CFO of UnitedHealth Group, and Dr. McGuire came in and offered him a large sum of money, and suddenly we were sold. And right 2 weeks after I joined, and we closed the transaction probably about 4 months later in December.
I hope you immediately vested your equity.
I did, yes. It wasn't a terrible thing that happened, right? We all dream of those things. But I really wanted to take the company public, and it was a great opportunity. 2004, and then of course there was the stock backdating, which took our stock price down, and so then you had to sit on. And I literally was only going to stick around for a couple of years because I said I'd never stay anywhere longer than 4 years ever again, because I did that in the financial services business, and it was too long, and I wanted to keep moving around and doing new things. Well, I stayed at United for 16 years. And, I was put in charge of the integration of Definity into UnitedHealth Group as aspects of it, not all of it, because it was huge. And then after that, there were some leadership changes. And the CIO and the CEO of UnitedHealth Group, then Steve Hemsley at this point, asked me to partner with Cisco to build this telehealth opportunity between the two companies. And Cisco was building health presence at the time. I got to work with some great people there. I got access to some amazing things. And we took health presence and we built it into a 53-foot semi-trailer, all doctored up. It looked great. It looked like a literally rolling clinic with a satellite dish on it, because that's how we were transmitting and getting connection all over the country. And we rolled it into Capitol Hill in Washington, D.C., July 15th, 2009 to be exact, and it was a huge hit. Steve Hemsley showed it to the legislators, and they all were coming through, and it was a great experience. Cisco had a good time with it. And from that experience, the CIO and the CEO, then John Santelli, the CIO, said, we want you to build an innovation team. And I said, great, that's exactly what I like to do, because all my career I've moved from writing COBOL into other things, and I wanted to always keep moving forward, trying new things. And so we did. We built the Innovation Research and Development Organization within United, and I ran it for 10 plus years, which is amazing, because you don't do anything at United for 10 years typically. You usually move around.
Very, very, very well.
Well, and that's what I want to believe they thought, and I did. After 10 years of doing it, I sort of got the itch to move back into the startup place, because working in our IRD, as we called it, I worked with a lot of startup companies, and I protected them, because large companies like United can consume them. Startup CEOs make the mistake that, we got UnitedHealth Group, but sometimes I say that's not the best thing that can happen to you, because they will consume you. They will bleed you dry to the point where you go, when do I get a check? Because you're going to work through so many iterations with them before you actually go live. And you have to be careful of that. So I protected a lot of startups in that regard as well. But it was a blast. I got to work with some great companies. I got to meet people that, growing up as a tech lover, meeting guys like Steve Wozniak and Esther Dyson, she was fantastic. John Scully. I never in my
pinch me moments.
Yeah, and for a lot of people that work in tech, that's pretty cool. I mean, I ran into Bill Gates literally at Comdex. We like ran into each other and just about both fell down. I mean, it's stuff like that reading Byte magazine and all that back from the day, never thought I'd have the opportunity to do. It was amazing. So from there, we got to build this innovation R&D organization that really allowed us to show up in front of the largest clients and close deals for the sales team. We built platforms like Health Plan Manager that gave executives of the company buying our services, our benefits, insight every 30 days into how their plan was performing. Prior to that, they would get like a PDF of 6 to 9 months later of how good or how bad it was working. And we said, well, why don't we build a briefing book, if you will, that allows them to see it live? And it was a huge win. And then our competitors were like, how did they do this? What are they doing? How do we do it? And some of the people that were working on my team got recruited away to go work for other payers. And they called me and go, oh, you guys were in another finalist meeting, weren't you? We lost that deal. I'm like, yeah, we were. It was a blast. And I don't know how much you follow CES, but we were the first health plan. It was our team that showed up at CES, and they built CES Health because of it. And it's a little bit of a joke, but we were in a 8x8. We were showing what we had. We had built Connect. Using the Microsoft Connect platform, a physical therapy platform for remote physical therapy. And so we showed it at CES as our first thing. Wow. Literally had an 8-foot table with a tablecloth on it. And right next to us was Trojan.
Hinge before Hinge existed.
Yes. So it was us and Trojan.
I love the Hinge guys. Yes. And that whole executive team, they've been great to me over the years. And, it's been a lot of fun helping them build what they built. So.
No, and it's really fun to see some of the stuff that we did early on, back in the early, 2008, 2009 timeframe, start to become reality now. Just virtual health, which we started working on with Cisco and figuring out all those things, what worked and what didn't work. We made giant mistakes in certain aspects of it, but we learned through those mistakes incredibly. So it was a lot of fun. And I have nothing bad to say about working at United. They were fantastic to me. They let me do things that, you dream of growing up. But it was time for me to go. And I worked my way down from a large organization to, it was just me and an executive assistant. So I could make myself available for exit. And they were nice enough to do it. They came to me in 2019, said, okay, we can move you out. We're going to move you out. How about November of 2019? And I said, can we push it to March of 2020? And they go, yeah, we can do that. And they did. And they let me kind of just hang out and do things.
It's
and
a very interesting time to start something new, just
yeah,
based on my recollection of what was going on in the world then.
Well, it was interesting because I wasn't going to start anything. I was literally going to go advise. I was going to get on the board. I was going to potentially work at a PE firm of our CEO or now chairman's family office and working on all of those details to do that. And you're right, COVID hit and the world stopped. My wife and I were living in our RV, driving around the southern part of the country, and literally when COVID hit, we ended up in like near Sacramento, California, and everything shut down. And we're like, oh my God, how are we going to get home? What are we going to do? What does this mean? You can't get food. And eventually we just jumped in the RV and we drove all the way back to Minnesota and got home and parked it and watched this thing unfold. And it was crazy. And, the interesting part of it all, Norm, is I was involved in a company that's NeuroDX. We were in the testing space. We were selling test kits for COVID very quickly. We were selling the pipettes for testing, all of that. And Miro has evolved since then. It's turned into a much different company in the wound care space. It's incredible. And we as Empower Health support them in a unique way that I can touch on later. But anyway, long story short, United was a fantastic place for me to work. I built so many strong relationships and just have so many great friends from there that are now everywhere in the healthcare system. And so reaching out to them has been fantastic for this company and our growth.
That's great. Well, of all of that great information, I think moral of the story is, like, if a top-notch recruiter calls you, you should listen and consider other opportunities. Because if you never took that call, you don't end up having these last decade plus of success stories. So it's great. Talk to me a little bit about what you're most proud about. You mentioned so many accomplishments. Like, what sticks out?
United's a company of different incentives across the organization. So getting people to row in the same direction can be very challenging. But I would say we did a really good job of that. And that's something that I get noted for that we did. We worked across a very diverse organization. They've got Optum, they've got UnitedHealth Group, and those don't always see eye to eye. Well, we brought them together in a lot of cases because Optum provides the health services. Of course, UnitedHealth Group provides the benefits. Sometimes they don't agree on terms and how things come together, but I think we did a really good job of bringing those two together. I think we also did a really good job of building a great team of leaders and tech experts in our tech platform. I mean, we got into AI back then. We got into a lot of things that were well ahead of its time in healthcare. We built the first mobile solutions in healthcare that I recall back in the early 2008 timeframe that was a game changer. And I remember one executive on a call saying, well, if we build this mobile solution, will we make money? And I said, if you don't build a mobile solution, you won't make money. You have to have a mobile solution. And we did. And we won a lot of awards for it. And I'm fortunate to say that one of the key leaders of that now works for us at Empower Health, and she led the development of all our mobile, and she's fantastic. So
that's great. What were some of your biggest struggles and biggest challenges?
Well, again, working across a large, diverse organization and securing budget and protecting our budget while the business success ebbed and flowed. We can't spend this on innovation anymore. And interestingly enough, when I started the innovation group, we reported to UnitedHealth Group, the holding company. Mm-hmm. At some point, we were moved over to Optum. And so now our budget became a little more, you had to protect it pretty good. And I remember the day it happened. I was at a investor conference, and Steve Hemsley, who then was the CEO, says, are you moving over to Optum? I go, that's what I hear. He goes, oh, okay, well, let me know how that goes. And well, if I could have had it done over again, I probably would have stayed at the holding company because our budget was pretty well protected there, and we got to do some amazing things. Once we got into Optum, again, great company, you had to fight for your supper. And thankfully, I had two brothers, so I was kind of used to that. So, but that was probably the biggest challenge, was really protecting your team, protecting your budget in an organization where everybody fights for budget. So
you worked in a very senior capacity at a Fortune 5 company.
Yeah.
And you've also now been CEO of a small startup. I find this very interesting in that I personally believe that there are certain people that are built for early stage companies. There are certain people built for late stage organizations. And like sometimes you can put a really great person in one of those buckets in the wrong environment and you're just setting them up for failure. And then
Yep.
in other cases, like you have some people that are in the wrong, area for their skill set. They might do well in another environment, but they would do even better in an environment that's more suited for their skill set. So I guess my question is, what makes someone a great Fortune 100 employee and what makes someone a great startup employee? And how are those two different, even if we're still talking about people that are ultra talented and really good people personally?
I mean, the simple answer is adaptability and really fashioning the environment you need to strive and thrive in. And that's a great question, Norm, because I've thought about that a lot because I don't think I'm a Fortune 5 person, never did. I remember when I worked for a $1.8 billion
You did very
company.
well in that environment.
Well, I did because I was able to adapt and most importantly, fashion an environment that let me do what I'm good at. And that's building startups within a large Fortune 5 company. And that's what we did. We basically brought in entrepreneurs and residents and gave them things to work on and budgeted them, funded them, and treated them like startups. And so now I've become kind of that in this role. But it all came down to adaptability and then fashioning an environment that allowed you to thrive. Because, I'm not going to lie, I got pretty bored building purse management for FSAs and HSAs when I first got in here. It was, it's great. We got a team. We'll do this. Yep, we'll make it happen. And we figured out ways to impress our leadership, make them look good, make the company look good, and then they wanted more of it. And you basically create innovation addiction to them. And that's kind of what we did. And I had an incredible team. I mean, Nick Martin, who is my CIO and EVP of product in Power Health, you put him on a stage and he could hold 250 of the largest employers in his hands talking about what we were doing in innovation. Nick is such a talent when it comes to that kind of stuff. And then my CFO at Empower Health ran a $4 billion P&L within United. Now he's used to counting billions. And so when we're getting down to hundreds of thousands of dollars in the bank account, he gets a little twitchy, I'm not going to lie. But he's a genius. He can price like nobody's business. He understands the procurement process because he was responsible for it at the largest payer in the world. And it gives us a leg up. And I thought it would give me a leg up, Norm, that would allow me to move quicker through a procurement process with a large payer. It doesn't. You still have to go through that process. And it's funny because when I was running innovation R&D, startups would come to me and go, how do we get in here and what do we do? And I go, here's the thing. Get between us and our customer. And you'll probably get in 12 months because we need to take care of that. But it could take 18 months or 24 months. That's just how it works with these payers. So if it's a really important deal, 12 months is as fast as it goes. And that really hasn't changed. I mean, it took us 16 months to get a contract with a very large payer that isn't my former employer. And we're still waiting to develop a statement of work with them. And it's just, they're slow. They have these organizational changes, breaches occur, and suddenly they go into a fetal position and they change everything. And so then you end up with all new challenges to get through that process. So I went a little further than you were asking, but that's really what it is.
It's incredibly helpful. In terms of someone, that maybe worked for you or with you at United, and you're like, hey, they are so talented and so great in that environment, but I know they probably would struggle in a startup environment. Like, what is that? Like, is it purely like, hey, they just aren't adaptable? Or what are the other things that usually someone in one environment can really struggle when they go to something much more
that's,
startup in nature?
people that don't handle change well, that's probably the biggest thing, Norm. They want consistency. And we did leave some people behind that just want that consistency. We would love to have them, and we think we could shape an environment that would give them the ability, and maybe eventually we will, but we're not there yet. We're still fairly early stage. Even though the company's been around a while, we did a pretty significant pivot. And with this whole new leadership team that we've brought in and the people that we inherited who are fantastic. I mean, the legacy employees that we have at Empower Health are just incredible. And one of the quick changes we made at Empower was to make sure that we had an operations team because they didn't have one when we got here. And now we do. And it's run by a gentleman that is just fantastic. And he's a Six Sigma black belt, but you wouldn't know it by talking to him. He's just so good at what he does.
Love that. What did your time at UHG teach you about just the US healthcare system?
There's tons of gaps. There's tons of opportunity to fix and fill. And that's what led me to say, I got to get back up in the startup industry, because there are gaps that they're not going to close. But if we can go figure out how to close some of those gaps, and we got to, don't get me wrong, when I was at United, but there's so many more that we can do. You think of companies like GoodRx that really shined a light on cost of medications and figuring out how to get people better pricing. And I remember some epiphanies I had. I'm a type 2 diabetic, have been since 2007, and I learned a few things about my medications, and I brought it back to the company, like, shh, no, we don't talk about that stuff. And I knew there was an opportunity there. And I used to joke with some of the executive leadership. I said, if I ever leave here, I'm going to solve the PBM problem, and I'm going to do it with Salesforce in about 6 months. We're going to solve this problem. Unfortunately, I didn't do that, or fortunately, depending on where you're standing. And I did this, and I really love what we're doing. I think what we're doing at Empower Health is going to be really well understood and seen as it moves forward. And it's really starting to. This year has been really good for us.
I'm very glad to hear it. What inspired you to join Empower, first as an advisor and now as CEO?
Well, I actually started out as an investor in early 2020. I was brought in by a friend who was an advisor to them. He said, you have to take a look at this company. Tell me what you think. And he knew I was on my way out of UnitedHealth. And so I did. I flew into Miami and I met with Pat Byrne, who was a board member and a key investor in the organization. I met with Wolf Schleikman, who was one of the founders. And I was inspired by it. What they were doing and what I saw. And Wolf is a visionary. He's an incredible innovator, very smart man. And what he had developed was the start of something I thought was big. And having worked at, the largest health payer in the industry, I saw what call center calls cost. I saw what it takes to be successful. I saw what the failure rate on getting these calls placed was. And what Wolf was working on, I thought was a pretty big deal. And so I was excited to join them as an investor. And then as that went through, they came to me and said, hey, would you mind joining as an advisor? We've got a big deal coming together with UHG. We could really use your insight. And I said, yeah, I can do that. And we worked out a reasonable deal and did it. And a few months in, they came to me and said, would you consider a C-level opportunity with us? And I said, well, I wasn't looking for anything like that. I really just wanted to advise, board, and invest in companies. But maybe. What do you think? And they go, well, we're thinking CEO. And I said, okay. Let me go back to my mentor. And my mentor at the time, I have a number of mentors I'm very fortunate to have, but Steve Hemsley was one of them. And Steve is, like I said, the chairman of UnitedHealth Group. So I met with him and I said, here's what's going on. It's an interesting company. I think it's got a lot of potential. What do you think? He goes, you should do this. This is perfect. You've never been a CEO. You're going to learn a lot. You know a lot. And this would be a good match for you. Give it a try. And I was like, all right, well, the one of the smartest people I know in healthcare just said I should do this. So I did. I agreed to it. And May of 2021, I joined as the CEO of the company. And it's been an adventure. I will not lie. It's having been part of 9 or 10 startups before this back in the early 2000s, 90s, early 90s. Oh my God, I'm getting old. And I was never anything more than the CIO or the tech management leader. And so I didn't understand all the challenges with investors and everything else. But I had a general sense of it all. And it was quite an experience. I'm not going to lie. The first thing I found out is that we needed to raise money within 3 weeks of me getting there. And so we did. We raised $1 million in 3 weeks. And in the next 18 months, we raised roughly $8.1 million in friends and family funds. And then we closed a Series A in February of 2023 of $7.5 million. And that's kind of what we've done since we got here. And that was an interesting experience, to say the least. All the legal stuff you got to go through. I have learned so much. And so Steve was very right. I will learn a lot. And I did. I learned a lot of things I would do differently too.
Okay. Fantastic. Only way to learn is to try.
Absolutely.
I love that. So walk us through how you're using AI to work with providers, payers, employers, partners, and how does the platform work with each healthcare element?
Sure. It's pretty consistent with each element. It hides behind whatever they want it to. We white label Angel as it is for them. And what's really interesting, Norman, we got here and it was built on Google. nothing against Google. It's a great platform. But I know that the payers prefer Microsoft. I know that because I was in part of those discussions with Satya Nadella and all that when I was at United. And they prefer that platform because they don't see them as a future competitor. And so we moved actually over to the Microsoft Azure platform and the Cognitive Engine. And it was a good move. And Nick did a fantastic job with his team to get us there in a very short order. And at the same time, get us high trust certification, TCPA, regulatory coverage, everything we needed for that. And we used the tool to guide millions of personalized conversations and gather information and share knowledge back to the member or the patient, depending on who we're working with. You know, we can manage challenges like a care manager or nurse shortages. We can also help with clinician burnout. You know, you think about UnitedHealth Group as an example. They make lots of phone calls, and they do it with nurses. Nurses are not inexpensive, and nurses like to practice at the top of their license. So making, you know, rudimentary phone calls that really aren't value add from a clinician standpoint, if we can do that, it's highly valuable, and we do it in mass. And we've got over 10 million plus minutes of calls recorded from our experiences, and we're just getting started. That's going to quadruple in short order based on some of the new clients we've signed. And it frees up staff time for focus and other care delivery things, and it reduces escalating and unsustainable costs. And we find that extremely valuable, as does our clients. We've had a really good experience with the clients.
Hey, at one point you were a client, like for this type of service, or at least needed something like this, you can kind of see it from their perspective, which is fantastic. Walk us through Empower Health's conversational AI digital health assistant, and like, how does it actually work in practice?
So that's a great question. So, you know, one of the key things that I think makes us different in the industry is we didn't buy other companies and bring them together. We built a single back-end norm that ultimately talks to multiple modalities. And so we can talk in voice, which is really important, and we'll touch on that probably a little later. We can do secure chat, and we can do SMS. So secure chat meaning we meet the HIPAA and trust security requirement, and that's so important. And it's a key thing for us. And the other thing that we do, Norm, that is interesting with the platform is we do it in 72 languages. So I actually had an investor on a call one time, and we were running one of our demos, and she said to me, "Boy, this would be great if you could do it in Hindi." And I said, "All right, well, Angela, our product manager, was sitting in the background listening to the call, and we went through all the details, and by the end of the call, we had a Hindi version of it, and she invested, like, immediately."
Love it.
So, yeah, and so the platform allows us to work across all the different modalities. We still can even fax. And a funny story about that is when I was at United, we tried to figure out how many faxes and how many people manage faxes in this company. It was 4,500 FTEs. 4,500 FTEs. So fax is still a technology in the industry, believe it or not. And I'm sure that number has come down, probably not much. And that is still an important modality. We don't tout it, we don't push it, but if somebody asks for it, we can do it. And we use our solution, and we develop an understanding and a use case of what people are trying to do. And you know, the best medical management, the best chronic disease management comes from the client, always. Even if we have a better idea, we gently push them in the areas that we know we can increase engagement and activation for them, but we really leverage their knowledge, and each implementation is unique. But again, our product team has done a phenomenal job building a platform, Norm, that allows us to deploy very quickly. When we got here, it was 4 to 7 days. It took technology, it took product, and it took now the new operations team to do it. Our recent release of our platform and our console, I think they deployed a new client in 20 minutes. Now, so our part of deploying a client is easy.
4 to 6 days is pretty good, but 20 minutes is better.
Yes, but what we do tell clients is we like 60 days because you got to work through all the use case and understanding the flow. But then you can build these incredible scripts and get engagement to a point that's just unbelievable. And, you know, Nick, who's always a perfectionist, I mean, Nick, literally, we built the Experience Center at United. Nick would trim the carpet with scissors because he wanted it perfect. Well, he again, he's our CIO and product. He wanted Angel to sound so real you couldn't tell it was fake or an AI. And he made it so good that our engagement dropped off. And that was an interesting learning because people immediately realize that, or they don't realize, is this a person or is this an AI? When you leave that roboticism in there just a little bit, not a lot, they feel a lot more comfortable. Interestingly enough, they share more information and they engage at a higher rate. So it was an incredible learning for us because we thought, well, let's tweak this thing and make it sound like a real human. And we learned from our constituents that that wasn't exactly what they were looking for. And it really changed the game for us to really understand that.
That is so insightful, and it goes deep into human psychology. I think humans do not want to be judged by other humans. So anytime you can like take that element out of it, it definitely greases the wheel.
Well, and that's a great point. When I was running telehealth at United, women did not want to get on the camera. So we started looking and working with Microsoft on some avatars so we could give them a likable avatar that gave them the opportunity to come on, because you look for those things. But I will tell you, if women needed to be on the screen with their child in a minute, but if it was for them, they didn't want that. It was learning those things because I'm a guy. I'm like, I don't care. I'll get on the screen, whatever. I've got a face for radio, but I'll do it. So, yeah.
Love it. Do you find certain patient populations have more hesitancy towards AI than others?
Not in any large way. You know where the hesitancy is? It's with the client. The client is like, how are they going to react to this? What are they going to do? And we're like, trust us. You're going to see numbers that you've never seen before. We have overrun call centers, Norm, with engagement. The numbers they never expected to occur. And we've saved $72 million in readmission reduction across 847,000 members in a 12-month period for a company, of which 59 million of it was clinical savings on readmission. Readmission is worth about $14,500 per readmit, and that's what it costs. On top of that, we saved almost $13 million in workforce savings because they didn't have to hire those additional people. People seem to interact with this platform very well. I think Angel would do a great job with my father, who will talk people's ear off. If they call him and want to sell him something, they'll hang up on him eventually. So, and I think Angel could go toe to toe with my dad, which is not easy to say. So,
yeah, no, I remember the old voice assistant type like service models from like direct to consumer businesses.
Yep.
And like it's gotten better over time where at first, like I'll use the airlines as an example.
Yep.
First used to talk to a human. Then they went, kind of towards the automated model and you're like, this is worse. Like this, I'm not getting anywhere. Zero, press something so I can talk to a human. Now, like I'll call Southwest Airlines. I want the AI. I can get what I need quicker than going through humans. So it's like interesting, even in consumer applications, how, the preference was human. Then it was kind of, okay, like there's going to be some kinks here. And now it's like a lot of us want to prefer.
Norman, it's so true. It's so much more efficient. I mean, I've yelled representative probably more than anybody in this industry when I get on a phone call, even with my former employer as a member of their health plan. So, you do that and you get kind of used to it. And that's the part that we fight a little bit because that's what we remember. And if you don't realize what a solution like Empower Health Angel can do until you feel it, and then you go, wow, this has changed. This is going to get better. And, I think the industry is in for a really big change as we move forward. I really do.
Yeah, absolutely. Empower AI can help confirm eligibility, identify and close care gaps, improve medication adherence, reduce hospital readmissions, which is huge, as you described. How has the market responded to Angel, the virtual health assistant so far?
So I'm not going to lie, getting in is the hard part. Once you're in, they love it. One of our customers sells us internally across their organization. We're doing redetermination of eligibility of Medicaid because they said, God, we could use this for that. And it was huge. And we didn't sell that. They came to us with it and said, we want to do this. We want to do it in March. Well, we were ready to do it in March, but it took them till September to really get ready for it. But it's been fantastic. And the returns on that have been solid. And, we have 100% client retention with an exception. We had one customer who came to us and we engaged their population so fully that they learned very quickly that they had a very flawed business model. It was a startup company trying to do healthcare. And we engaged their population so fast that they couldn't react and they ran out of patients that quickly and they couldn't get more fast enough. So they actually shut down the business. Another company came to us and said, I've got 12,000 members. We've got an RPM solution. Can you guys help us engage them? So, yeah, we can do that. And we worked out a deal, another startup, none of us have money. How do we do it? We get paid this much if it happens, and then they get a monthly with this thing. And we worked out a deal, and we engaged in 3 days, 1,200 new members for them in a company that I think had 600 members at the time.
Oh, and with companies that get paid on utilization, like that is incredible for their business.
And it was great for us too. And the best part is when you can help another startup that's bootstrapping like we were and do that, it's very fulfilling for us and the team. We love it, and it's been fantastic. That is exciting to me, to watch how 1 + 1 can be 3 or 5, and we used to use that terminology all the time when we ran IRD. So.
Well, I can think of a couple companies off the top of my head that should be running to you asking for, help, because they're doing well with engagement. But if they do better, like, it's good for everyone.
Well, and it's interesting you say that, because we'll take on risk. You know what? If we don't engage for you, you don't pay us. We'll work something out, But we got to have the right measurements to make sure that, fair is fair.
I love it. As AI evolves so quickly, what do you see Empower Health evolving towards over the next 5 years?
I think we'll become the glue or the conduit to a much bigger thing. I think we will be that backbone. And, when I worked at UHG, one of the things I had the great fortune of doing was managing the Salesforce implementation across the organization. And actually, the gentleman that runs all of healthcare for their competitor, ServiceNow, used to work for me as well. And what I saw in that is a core system like this in a Salesforce implementation in healthcare is a game changer. And with the support and the growth of Salesforce, they could take a solution like ours and embed it into their Einstein AI pretty solidly. And not that I'm putting a sales pitch for them to come buy us, but that's what I see, Norm, is where we could evolve to over time in that, or an Optum, or Evernorth, any of those companies. And it's interesting because PE firms come to us. They first off love the leadership team we've been able to develop. They love the technology, and they're like, what if we stack more things on this? And I said, we're almost ready for something like that. And what I mean by that is we want to get our revenues up because we want to take care of our shareholders. They've been here a long time, and we've been here 3 years, and we want to help the shareholders feel good about a solid exit, acquisition, transition, whatever we want to call it. And that's really important to us.
Well, that's a great job of being a fiduciary, so
yeah.
Really enjoy hearing that. How do you see AI evolving within care delivery over the next decade in the United States?
It's a great question. My daughter is in her 5th year of residency for orthopedic surgery, and it's pretty unique, first off, to have a young lady in orthopedic surgery. 4% of them are women. I foresee she'll be using a digital assistant of some sort that helps her understand what's going on with the patient. It brings in all the medical information, because I think about, we had the natural history of disease at United, and we could find medical pairs of people. So we could look up people like me who were a little overweight, I was a lot overweight at the time, and we could understand their therapies and where they went with things for type 2 diabetes. This person thrived because he did this. This person didn't because he didn't do anything. And so where do we find the in-between? And I think you're going to now see platforms that help clinicians, physicians, and other surgeons make the right choice for their patients and help them immensely. I think those things are going to come. And I think that's the evolution we're going to see. And I think a solution like Angel will fit into that as well. And it will help, it'll go collect that data that doesn't exist. It helps us to make those decisions, because we collect a lot of data. And we push it right into the call center systems. We do whisper transfers with Angel. She literally will talk to a live agent and say, I'm going to transition this patient to you. It's such and such. They're looking for home delivery of their medications. They need a hemoglobin A1C test, and they also need a ride to the next doctor's appointment. We do SDOH. We do all of that. And what's unique about voice in that regard, and I think you'll see more of that in AI, is if you're doing voice, people will go on and on about, have you taken your medication today? If it's a text, they say no. If it's voice, they'll say, no, I don't have any money for my medication. You capture that and you share that SDOH back to your patient's carrier. They really appreciate it, and they do things to help it.
That's incredible. Doing good work and great work all at the same time. You're on the board and you are an advisor of a lot of cool companies. What's your philosophy when it comes to being a board member, and how do you personally contribute to a company's growth?
It's a great question. I help with a lot of things. There's one company that wasn't on here, but I'll use it as an example. A company called Care Parent that does a lot of home care for seniors and veterans. And it's super fulfilling. It's not a huge company. They do maybe $8 million a year in revenue, but they're doing really good stuff. And I love helping them get more efficient and better. And when I joined the company, it was run by the elders in the family, and they were going to hand it to the kids. I didn't know that. And then they handed it to the kids after I joined. And I said, okay, I want to see dashboards. I want to understand how you're running your company, what makes you more efficient. And these kids took off. They built these dashboards of operations, revenue, finance, how they're managing their staffing, because staffing in those businesses is one of the toughest things to do. And they became incredibly smart about their business, and I was super impressed by it. And I think they appreciated that guidance. I love stepping into companies and helping. Like I'm on the board of a company, advisory board of a company called Firefly VR that's doing VR therapies for people. And I turned it into a subscription model with my suggestion was, let's make this a subscription. Other people can put their environments in your platform. And I think they appreciate that kind of stuff. And I see things differently. Sometimes it's good, sometimes it's bad, but mostly it's good. And I grew up living in data. And so you look for relationships of things, whether it's people or things in your life. When you're driving down the road and you see a bungee strap on the road, you wonder where it came from and why it fell off that trailer. What did they miss? It's stupid stuff like that. But it really gives me incredible strength, because to look at things and look for relationships or why things aren't working because of the relationship. And it's been super helpful. I preach to that to young kids coming up. I go, yeah, you can learn how to code Python, but understand what happens with the data. That's far more important, because everybody can code Python at some point. So
yeah, well, I couldn't, but that's okay.
Well, you could in a couple weeks.
For another day.
Yeah.
But you've worked with a lot of startup founders. You've invested in some. You've advised. You sit on boards. You've seen a lot come and go, some be successful, some not. Like, what are some core traits that you've noticed that a lot of the successful ones have in common?
Wow. That's a great question. And it's perseverance. Every day is a new challenge in a startup company. And you've got to figure out how to lead the people, give them the guidance, have a place to go and unwind, because you do need that. And my leaders come to me, they have a bad day. If the Jets lost, my CFO will call me on Monday and I'll hear about the financial challenge plus the Jets. And love him to death. I would go into the foxhole with the guy from a startup standpoint anytime. But you have to be that listening board as the CEO of a company. But you also have to figure out, how am I going to deal with my stress when I have it? And I'm very fortunate. My wife is very good at it, because there's a lot of it. This is the hardest job, Norm, I've ever had. I'm not going to lie. There was a time when I was worried we were going to make payroll 2 months out, and that stresses me, because you work for a Fortune 5 company, you never worry about payroll. You never worry about your investors. You really don't at my level. Certainly at Steve's level, the CEO or chairman, he has to worry about that stuff, but I never did. And now I do. And I get calls from, shareholders that have $700 invested in this company through Start Engine. And you have to react to them as though they put $700,000 in. And that's a stressful part of the job I didn't expect, frankly. It doesn't mean I shouldn't have expected it. That was just my miss. But it's perseverance and getting through challenges and not losing focus. And that's been my biggest note to people that I work through. And I've worked with a lot of CEOs that made it and didn't make it, and they're great people. It's just, it can wear on you. And, I've only been doing this 3 years. I met with a CEO of an incredible company that is about ready to cash for lunch yesterday. He's been doing it for 11 years, and he's probably 19 years younger than me. So think about that. And this company is really cool. I'm excited about it for him, and I think he's going to exit. And I think it's time after 11 years. And he's a great guy. It's just really fun to watch, and I love being a mentor and advisor to his company.
Well, I would give the advice to the person who invested $700 in your company that your time is best spent working on the business, not updating investors of what's going on.
Well, and that's a great point, but unfortunately, unsophisticated investors that come through like a Start Engine, that's why they come through it. They don't know. They don't understand. I didn't make that decision to use Start Engine. That happened before me. So I inherited, 300 shareholders at $1,000 or less. So
yeah, there's advantages and disadvantages to everything.
Yep.
You got to take the good with the bad for sure. You mentioned like, hey, you're in a very stressful job and like you need to manage your own stress because a lot of stress gets like elevated up to the leader. How in a very stressful job do you reduce stress and participate in wellness yourself? Like, how do you practice what you preach considering this is our profession, but it also has to be like we have to live it in our personal lives as well?
That it's a great question. And, I spend a lot of time with my classic cars. I collected some cars. I grew up loving cars and I've collected old cars that I'll go out in my garage and I'll work on them and I'll just check out completely. Or, my wife and I will travel. We have an RV and we travel. And like we just came back from the big motorcycle rally in Sturgis, South Dakota with a bunch of my old friends from UnitedHealth Group who invited me the first time. So, and we camp and we have a great time. We ride. We're in bed by 10. We're not partiers. But that is so important to do and critical. And, probably since I joined this organization, I've lost 100 pounds. And that's a game changer. And now I can't tell you I did it because I did incredible hard work on my Peloton or anything like that. I certainly did a lot more than I used to. I will attribute some of it to Ozempic and Mounjaro. It's been an amazing medication that's taken my A1C down from in the 10s to 5.7. And my diabetes is managed so well. I don't eat like I used to.
Feel better.
Oh, 100%. And it gives you the ability to do what I do every day. It's hard when you're massively overweight like I was to do this every day. And so this has been a game changer. And I don't want to call Ozempic or Mounjaro a miracle drug, but it made a big change for me. And I'm not promoting it for anybody else. Make sure you talk to your doctor. But it changed my philosophy on food. It changed my relationship with food, Norm. And that was so important from a lifestyle that I was living. And it's been a game changer. Plus, we have a workout room in the house, and I've been known to walk through it a few times and enjoy that. My wife does a lot more of it than I do. But we love to travel. We love to go see things. And I love to work on my old cars and spend time in the garage when I can find the time to do it.
All right. Well, everyone, reduces stress in different ways. I think if someone had me try to fix a car, that would be a more stressful situation than less. But, for you, it calms you down. So I love that. Very, very good. And you mentioned what you're putting into your body obviously has a huge impact on health. I think something I've noticed, just being a student of the game for this long, is that a lot of people want to eat healthy and sometimes they just need the inspiration. They need ideas from other people that have followed that path before them. So I'm just wondering, during this journey, are there any healthy recipes that you or your wife at home make that make it easier for you to maintain your lifestyle and make the changes you did?
Yeah, absolutely. Well, first off, we've gotten away from a lot of processed foods. I make a lot of chicken, a lot of fish. We still do beef, don't get me wrong, but we're always very focused on our vegetables, everything else. And, I have a smoker, and so I've got a pellet smoker, and I make lots of chicken on it. We freeze it, we pull it out. It's just fantastic. And I love the process of doing that. Like when we went to Sturgis, I did 25 pounds of brisket, and they all look forward to it every year. Smoked brisket is probably one of the best things you can do on one of those things. And it's amazing. My wife cooks. She doesn't like to cook, so I do most of the cooking. And
me as well.
Yep. And I love to cook, and I guess that's another way for my stress to go away is cooking. And when my wife loves what I make, there's nothing better. And when my family does,
for me as well.
Yeah.
So
yeah.
I can definitely agree on that. Well, Bud, this was fantastic. Really appreciate you for joining us on the Digital Health Heavyweights podcast. Great journey from your time at UHG to now, being CEO of a startup that's doing incredible things over at Empower Health. So thank you so much for joining. And we're very excited to, continue to watch the success story and the journey that is Empower going forward. So thank you for joining us.
Norm, thank you. And thank you for what you do in this industry. I will be a subscriber and a listener on a regular basis. I love these kind of podcasts. So thank you so much.
All right. Thank you. Appreciate it, Bud. Thank you for joining. Please like, comment, and subscribe below if you enjoyed it.